Hey, future nurses! Hey! Are you ready to become a hernia expert in just a few minutes? Today we'll talk about hernia repair, its types, and nursing care. But don't worry, we'll make it fun and interactive. Grab your notebook because we'll have quizzes, memory tips, and mini challenges along the way. What is a hernia? Voiceover. Quick question. What exactly is a hernia? A broken bone. B. A protrusion of an organ through the wall that normally contains it. C. A type of infection. Yes. The answer is B. A hernia is when an organ, usually part of the intestine, pushes through a weak spot in the abdominal wall. Fun tip. Think of it as your intestines saying, "Hey, I need more space. I'm popping out." 2. Common types of hernias. Voiceover. Let's play a mini memory game. Types of hernia. 1. Inguinal hernia, most common, occurs in the groin area. 2. Femoral hernia, below the groin, more common in females. 3. Umbilical hernia, around the belly button. 4. Incisional hernia, at the site of a previous surgical incision. 5. Hiatal hernia, stomach pushes through diaphragm into chest. Mini challenge. Can you remember which hernia is most common in men? Answer, inguinal hernia. That's it. Well done. Tip, I equals inguinal. M equals men. Easy to remember. Super bright. 3. Hernia repair surgery. Voiceover. When hernias don't go away on their own, they are repaired surgically. 2 main surgical techniques. 1. Open hernia repair. Traditional method. Surgeon makes an incision, pushes the organ back, and repairs the wall. Often uses mesh to strengthen the area. 2. Laparoscopic hernia repair. Minimally invasive. Uses small incisions and camera. Faster recovery, less pain, smaller scars. Fun fact, mesh repairs are like putting a reinforced patch over a hole in your wall, but for your body. 4. Nursing care before surgery, pre-op. Voiceover.
So, you got the flippy doobie.
Time for a mini quiz. Woo! Which of these is important before hernia surgery? A. Assess patient's history. Yes. B. Monitor vital signs. Check. C. Ensure consent is signed. D. All of the above. Correct. D. All of the above. Other pre-op tips. Teach patient breathing exercises. Encourage early ambulation after surgery. Prepare the patient psychologically. Reassure them. Memory trick. VCH equals vital signs, consent, history. Helps remember pre-op steps. 5. Nursing care after surgery, post-op. Voiceover. Now let's talk post-op care. Key points. 1. Monitor vital signs frequently. Office. 2. Check surgical site for bleeding, infection, or swelling. 3. Pain management. Give analgesics as prescribed. 4. Encourage early ambulation to prevent complications like DVT. 5. Educate patient about avoiding heavy lifting for several weeks. 6. Diet. Soft foods initially. Prevent constipation. 7. Teach proper wound care and hygiene. Mini challenge. Which one of these is not recommended post-op? A. Walking around. Tick. B. Lifting heavy boxes. No. C. Eating fiber-rich foods moderately. Do that. Answer B. Lifting heavy boxes. No. Fun tip. Think walk, rest, eat, care equals rec. Easy mnemonic for post-op care. 6. Complications to watch for. Voiceover. Quick interactive quiz. What could go wrong after hernia surgery? Bleeding or hematoma? Infection. Recurrence of hernia. Pain and swelling. Urinary retention. Answer! All of the above! Remember, early detection and reporting to the doctor can prevent serious complications.
So, you got the
7. Patient education. Interactive tips. Voiceover. Teach your patient these 5 key points. 1. Avoid heavy lifting for 4 to 6 weeks. 2. Walk daily, but gradually. 3. Monitor surgical site for redness, discharge, or pain. 4. Eat high-fiber diet to avoid constipation. 5. Take medications on time. Mini challenge. Try repeating these 5 points in under 10 seconds. Conclusion. Voiceover. So let's recap. Hernia equals organ protrusion through weak abdominal wall. Types: inguinal, femoral, umbilical, incisional, hiatal. Surgery equals open repair or laparoscopic repair. Nursing care equals pre-op, VCH, post-op, rec, patient education. Complications equals bleeding, infection, recurrence. Remember, nurses, good nursing care can make surgery safer and recovery faster. Bye! Thanks for learning with us. Don't forget to like, share, and subscribe for more fun, interactive, and easy-to-remember nursing tutorials.
What happens? It becomes a wiggle-woo mountain. Now it's a flibber flabber.